Hi, this is Meldita, and our topic for today is diabetes mellitus and its evolution. There are two kinds of diabetes here that I'm talking about. The first one here is the IDEM. That is an insulin-dependent diabetes mellitus. This is called type 1. The second one is non-insulin dependent diabetes mellitus, NIDM. It's not requiring any insulin. Okay? On my left side here is pancreas. We all know about pancreas. This is one of the organs of the digestive system, and it makes insulin. And that insulin will transport the blood sugar into the cells. I made 3 columns in here. Okay, and the first column, the pancreas is normal. It makes adequate insulin, so that's good. And the response of the body cell, so far, they're sensitive to the insulin. That's why they're called insulin sensitive. If you look down here, this is the capillary, and that is the cell. The meeting point of the cell wall and the capillary, I'll show you there. So the insulin with the blood sugar arrive. The insulin try to unlock the door, and the body cell agrees. It opens the door, and the blood sugar was able to get in. So that's good. And how do we manage this kind of patient or, client? We encourage them to continue healthy diet and exercise because it makes their body cell more sensitive to insulin. The second column here, the patient is already diabetic, but before seeing the doctor, he will manifest some signs and symptoms. So this is a type 2 diabetes. The pancreas is abnormal. It makes less insulin. The body cell so far rejects the blood sugar in, and it's resistant to the insulin. So the insulin in the blood sugar arrived between the cell wall and the capillary membrane. The insulin tried to unlock the door. The body cell refused. The door remains closed, and the blood sugar remains outside. Well, before the patient will see the doctor, these are the signs and symptoms. The patient will feel or have frequent urination. So electrolytes out, blood sugar out, liquid out. So he will complain of being thirsty. Of course, liquid gone. Hungry, blood sugar gone. Fatigue, blood sugar gone. The energy, tingling sensation to the hands and feet. That's because of the effect of the high sugar to the nerves. And while seeing the doctor, blood works were ordered, and the results showed high blood sugar. And also the hemoglobin A1C is high. So what is the management or treatment for this patient? The doctor placed him on diabetic diet, exercise. Diet and exercise will improve the cell sensitivity to insulin and also lose weight if they're obese. The medication for this will be pills for diabetes, and they were asked to check their blood sugar, so they have to have a glucometer and follow up with the doctor. The third column here is now insulin dependent. That means the pancreas is abnormal, there's no more insulin produced, and we give them insulin by injection, and the body cells still responding to the insulin because the patient is managed by insulin. Same as the first one I showed you. Insulin and the blood sugar arrive. Insulin unlock the door. The blood cell agrees, opens the door, blood sugar in. Let's take a look at the management and treatment for this patient. Continue diabetic diet, exercise. Diet and exercise improve the sensitivity to insulin by the cell and also lose weight. Insulin injection, checking the blood works or the blood sugar, and they should have a glucometer and follow up with the doctor. Okay, I mentioned earlier about the hemoglobin A1C. This is the Canada reference. Hemoglobin A1C, that is the average blood sugar in the last 3 months. When the blood sugar goes to the bloodstream, it coats or glycates the hemoglobin, which is inside the red cell. And that is good for 3 months, so they can get an average for the 3 months for the blood sugar. Normal value is less than 6%. pre-diabetic or almost insulin resistant is 6 to 6.4%. If the patient is diabetic, it will be 6.5% and above. And if they are diabetic with medication, will be less than 7%. So these are the values that we see. So normal is less than 6%, but it's good. If they're pre-diabetic, their readings is 6 to 6.4. And if they're diabetic, the reading is 6.5 and above. And again, I mentioned earlier, if they're diabetic with medication, less than 7%. How about the fasting blood sugar here in Canada? It will be 4 to 7 before breakfast. It expressed in millimole per liter. 2 hours after eating, it should be 5 to 10 millimole per liter. In other places, they don't use millimole, they use milligrams per deciliter. All we have to do, if it is in millimole, just multiply the millimole by 18, and it gives you the milligram per deciliter. Okay. So we continue to educate the patient. We'll see their compliance. If these people will not comply and they are not on medication, this is the problem. They develop these complications in here, complications of diabetes here. We all know that the excess blood sugar will attack the arteries. They are one of the members in the plaque formation. So plaque is formed and then soon clot and blocked. So if you block the artery going to the brain, we have a stroke. And not only that, they attack the arteries, but those sugar that get away with the circulation, they go to those organs. They start damaging those organs. So eye damage, retinopathy, the heart attack if there's a blocked artery going to the heart muscle, kidney damage. We all know that the kidney is a filter, and the small unit glomeruli, they have tons of capillaries inside to filter the blood. They're very tiny vessels. So those blood vessels that suffer most with high sugar are the tiniest one, which are the capillaries. So anything distal organs supplied by the capillaries will suffer. As these arteries block or these capillaries block and die, the organ starts dying slowly as well. And the nerve as well. Because the nerve need also blood supply. And the injury brought by this high sugar. So it's not only the artery, but once this blood sugar reaches the organs, they start their cascade of damages. So it's not good. So if you like this presentation, just like and press subscribe on my channel. Again, this is Meldita. Till next time. Thanks, guys. Bye.